Hey guys, it's Dr. Akiba Green here from Lake Norman Health and Wellness. Is silent autoimmunity causing your thyroid symptoms? Well, let's find out. Autoimmune disease has been frighteningly common today. I tell you what, this degenerative condition, which can affect any tissue in the body or brain, happens when the immune system attacks and destroys the body as if it were a foreign invader. It's like the immune system thinks a part of your body, an organ, is a bug and it's trying to remove it. Chances are either you or someone you know has an autoimmune disease. Some of the more commonly known autoimmune diseases include Hashimoto's hypothyroidism, multiple sclerosis, lupus, rheumatoid arthritis, type 1 diabetes, celiac disease, and psoriasis. Now, although the statistics for autoimmune disease are alarming enough, shoot, it affects 1 in 5 people, the majority of them women. These numbers don't tell the whole story. The truth is that the autoimmune process typically is underway long before the tissue damage is advanced enough for it to be diagnosed as a disease. In fact, some people go an entire lifetime suffering from the symptoms of an autoimmune reaction that never progresses to the disease stage. This is because tissue damage and symptoms have to be quite severe or life-threatening before conventional medicine can offer remedies in the way of steroids, chemotherapy drugs, or surgical removal. It means untold numbers of people suffer from autoimmune reactions that cause symptoms but are not advanced enough to be diagnosed as disease. This creates confusion and frustration for the suffering patient. For instance, someone with an autoimmune reaction to the pancreas may struggle with keeping their blood sugar stable despite eating a very good diet. It's because she's on the path to possibly developing type 1 diabetes. It's estimated that 10% of those with type 2 diabetes, which is a lifestyle-induced condition, also have pancreatic autoimmunity and thus markers for type 1 diabetes autoimmunity. Another example is autoimmunity that causes hypothyroidism. Hashimoto's is the most common form of hypothyroidism. 90% of hypothyroid patients have Hashimoto's. It's very, very common. But here's the thing. Patients are given thyroid hormone in ever-increasing doses, but they're not instructed on how to dampen or halt the autoimmune attack on the thyroid gland. Nothing that is done in traditional medicine addresses the immune attack that's causing your damage. People can have symptoms that suggest multiple sclerosis, arthritis, brain disorders like depression, anxiety, loss of balance, loss of memory, poor adrenal function, irritable bowel, and others because their immune system is attacking the glands or tissues associated with those symptoms. However, the tissue destruction is not advanced enough to be labeled as a disease, and hence medicine has little or nothing to offer you. Fortunately, functional medicine shines in this arena. Specialized lab testing can determine whether autoimmunity is affecting a number of different tissues. Testing can identify or rule out the source of chronic, mysterious, and undiagnosable symptoms, such as chronic fatigue, chronic pain, declining brain function, gastrointestinal issues, hair loss, weight gain or weight loss, as well as more. This information can validate patients who have long been dismissed or belittled by their doctors for making things up. It's all in your head. There's nothing wrong with you. I tell you what, testing can uncover autoimmune reactions that are not causing any symptoms as well. A person may be producing antibodies, which is an autoimmune marker, to the sheaths that coat the nerves. It's called myelin. In its progressed stage, that will eventually become multiple sclerosis. I've had patients who are diagnosed with, or who we diagnosed with Lyme disease. They had a spider bite, in one example, and symptoms came on the next day. I mean, we're talking immediate numbness, acute onset bacterial neuritis. Went to the doctors, got MRIs, we had a neurologist we were working with. I'll tell you what, the neurologist saw white spots, saw damage on the MRIs, and said, you have MS. That's what it is. And you know what the problem was? MS doesn't progress in 24 hours. It's a slow condition that develops over time. And yet, the patient had damage in their spine and their brain from their autoimmunity. They were a Hashimoto's patient prior to this happening. But you know what? It was not an MS diagnosis. That was an incorrect diagnosis, and if she had continued on that path, she would have never gotten better. But because we identified and ran tests looking for the infection itself and were able to get rid of the infection, guess what? She got better. She didn't develop multiple sclerosis. She's better because the right diagnosis was done. And knowing this kind of information can give you more incentive to avoid inflammatory foods and pursue other lifestyle choices that may lower your risk of that silent autoimmune reaction becoming a disease. In functional medicine, we use a variety of strategies to dampen autoimmunity and relieve symptoms. These strategies include an anti-inflammatory diet that removes foods that you are sensitive to and stabilizes blood sugar, minimizing your exposure to toxic chemicals and metals. Adopting lifestyle habits that minimize stress, maximize well-being. Socializing, exercising, playtime, laughter are all key things. How about the use of natural compounds? Supplements, botanicals, herbs, vitamins, homeopaths, all these natural compounds that dampen inflammation, support the balance of immunity, stress, gut health, and blood sugar. Ask my office for more information or call today, 704-987-3993, to schedule your initial appointment with me, Dr. Green, and get your health back on track.